Hello, everybody, and welcome to today's session. Over the next 50 minutes or so, we want to talk to you about prescription processing, or more accurately, about the role that documents play in that, and even more so, how you can improve processing speed and accuracy with the help of collective intelligence. Collective intelligence is really a combination of AI and HI, as the title says. So you may wonder, what is HI? Very simple, human intelligence. The we is myself, Susanne Richter-Wilz, and I'm joined by my colleague, you see a little picture, Peter Müller. So I'm joining you from very snowy Hamburg and Peter from a bit better weather in New Orleans in the USA. We are representing ScaleHub. For those of you joining us for the very first time, we are a collective intelligence company based out of, headquartered in Germany, but with locations all over the world, including, of course, the US, where Peter is joining us from. So we would like to draw today upon many experiences that we have around the world when it comes to prescription processing and the important role prescriptions and documents related to prescriptions and its processes are playing in healthcare and health insurance processes around the world. A little bit of housekeeping. Whilst we present to you today, you have the chance in both channels you're watching to ask questions. So some of our team is live on there in each channel, answering the questions as much as they can, and otherwise pass them to us. And we have a Q&A session at the end. And of course, we'll be answering any questions we are not able to cover today in the follow-up of today's webinar or session. We are also recording the session, so you will receive a recording just in case something is happening that you are able to drop out, or there's somebody else you want to share that session with. But nevertheless, let's get started to talk about the topic today. So we talk about prescription. Prescription-like documents are very critical in a healthcare or health insurance process, and digital journey is very important as well. So this is an example of a study that shows a few countries which are quite ahead of the game, or have been ahead of the game for quite a few years. So they have been really looking at creating electronic prescription processes and are working towards having an end-to-end process being fully digital. But as you can see here in a few examples alone, there are gaps and breaks within the processes. So there is a lot of paper-related documents still to be processed in order to have a smooth process, to have a procurement process that's being complete, to have an control and auditor process that is complete, and therefore there are challenges remaining where collective intelligence or AI and HI can be a big help to solve these. Now, as I said, I'm joining you from snowy Hamburg in Germany, and this is a little bit outdated statement about what's going on here in our part of the world. So we are still going with a paper prescription to our pharmacy. And we are still going there, and these documents then follow a very lengthy process before everybody is receiving the revenues related to it. Now, whilst this report came out very recently, it talks about 0.1% of prescriptions being done electronically. That's not really true. So we are at around about 8% of those publicly created prescriptions. So that's maybe equivalent to NHS-like prescriptions in the UK and similar processes in other countries. We are around about 8%. So you can see a long way to go. So if you look around the globe, there are examples of almost 100% automation, where the gaps are remaining are still critical, but fewer and more complex, and other areas of the world, like us in Germany, where we are now on a very fast route towards a digital transformation process. But that's only covering, at the moment, part of our world, which is the public, as we call it that, and the private world is something completely different and still very much manual. So there are a lot of journeys out there digitally, and there's a lot of gaps remaining, and this is exactly where collective intelligence can be a help and can support that and improve the processing. Now, we only have 15 minutes or so, so the whole process and every document and every stakeholder involved in the prescription process cannot be covered today. And Peter and I are experts in the documents related there, but we're certainly not the experts in every part of this journey, and certainly in every country in the world. So we would like to really narrow this down a little bit, but to focus on some of the challenges that we see, no matter where we are dealing with partners and customers in the world, and which documents which are related to these processes. So very much we're diving in more in this kind of area where a practitioner is providing a prescription in a printed form. There is an entry of a prescription at a pharmacy, at some issuing center. There is an accounting center of some sort, maybe a special service provider involved. And of course, there's somebody who's then paying the bill and accounting for the data. So we're very much into going around this area with our examples today to bring the topic closer to you and talk about the challenges we see, but also the solutions we see with AI and HI in combination. So Peter is going to talk to you a little bit about the challenges we see and what AI and HI and collective intelligence is before I then take it further for you and talk about some of our most common examples that we're seeing at the moment in the prescription process, challenging solutions.
Thanks, Susanna. Yeah, and you know, we see the challenges within the prescription use case, but a lot of these challenges are for many different types of documents. But the reason why this is important is there's, you know, still process gaps with prescriptions, and you see it, you know, in the U.S. here with our healthcare system and how the prescriptions are moving through in some instances. Or think about care-related processes such as like physical therapy or other, you know, care that needs a prescription to even get through. That will still have some paper. Or think about maybe international visitors to a country where those processes could have a need. So, you know, overall, we're seeing those processes could have breaks or gaps or exceptions. And that's where, you know, what we're going to talk about today with collective intelligence can fill the gap. And the areas we focus on would be the turnaround times to get the information back and quickly out of the prescription documents. And many of our customers, they see volume peaks because you just don't know how many prescriptions will be sent day over day even. And how do you accommodate that as part of the model? In addition, you know, of course, all of us get to this point where we ask about data protection, security, and, you know, protecting privacy within a process. And so we're going to talk about that as a challenge that we focus on. And, you know, handwriting, you know, in Germany and in some of the countries, and even in the US to a certain extent, there is still that, you know, nasty handwriting that doctors prescribe, and it's hard to read. So how do you, you know, accommodate that in the model? So, you know, really how we know that we can focus on this is that collective intelligence, as Susanna mentioned, is the perfect solution to help address these challenges and how we go to market and differentiate ourselves as an offering and a value for our customers and for these use cases. So, you know, in our world, what if collective intelligence could reduce the gaps and the exceptions? That's the question we ask and we bring to our, you know, our customers in the different use cases. What if we could, you know, bring in external scalable workforce that is ready to go on the mark, and we're not compromising data or security in any way? That's a big ask, but it's how we do it. And in addition, you know, the speed and the turnaround times and the quality of the data, and still continue to have a consistent pricing consumption-based model that gives certainty about how you're going to do all these things at once. So let's talk a little bit about what collective intelligence really is and the benefits therein. So in a nutshell, collective intelligence, this term it's a known term, but it's not widely known, and we think it encapsulates, you know, the world we're in, and I think, you know, it's pretty clear that it's a useful coverage for combining artificial intelligence and human intelligence. So we're bringing in humans, and we balance that with our AI to maximize, the approach. So our, model and how we think about collective intelligence is really using the best of the human mind to feed the models, to bring it forward, and then back and forth they go. So our IP and our approach is to continually improve how the documents are processed, how the fields are processed, and human beings are added into that mix. So it really creates a very, very beneficial model and approach. So go ahead, Susanna. So, the big part of this is how do we distribute the tasks and where do we send them? We have workers all over the world, and these workers can be specialized. We call them, qualified crowd workers. So for example, if you have fields and documents that need to be seen by folks that are HIPAA compliant, we can accommodate that. If we're just taking pieces of a document or a piece of a prescription, we can take a snippet of that and send that to anyone really that is qualified within a portal to do key from image of that field. The thing that's really phenomenal about this is that we can activate 1,000 workers approximately every 10 minutes. And in the case of European prescriptions, we do that on a daily basis. We're doing that now. So, we can, when there's the volume fluctuations and we need to provide the high quality of data, resources can come in and out on demand, essentially. And we guarantee the full compliance, or the collective intelligence model guarantees the full compliance of the data within the regulations that are required. So really 24/7, independent of languages, independent of handwriting, we can use the global and local, even crowd workers to accommodate the work at hand. So when we're talking about the combination of AI and HI, the collective intelligence, we believe, including as many crowd workers as possible. So as I sort of mentioned already, we're creating micro tasks using snippets for the general approach here. So we're creating a human definable task that goes out to crowd workers. That's our job, or what collective intelligence does is creates a digestible micro task for the humans to work on. So we break down these tasks and we reduce the complexity to allow for, quicker completion, parallel work units, and we do that while ensuring data protection and privacy. So there's just one piece of the puzzle that all of these folks are putting into the total solution. They're doing it independently. And then our AI on the other end puts everything back together and delivers it in, in some cases 1 hour or less, or 30 minutes or less. And we don't hold back. We give the data back as quickly as we have it done. So, how do we assure data protection and a secure network in all aspects of that? So for us, and for our customers, of course, we have to ensure the highest data protection. So we're ISO certified 27001. We have obviously HIPAA compliancy, GDPR compliant. And so many of our clients are healthcare related. We're processing medical records, healthcare records, prescriptions is what we're talking about today. But there's, needs pretty much more or less with all these different documents to have the ability to send out snippets that are, in quotes, not ready for a broader audience. So what we do is we microtask, and we do that, using under the umbrella of our compliancies. So how does it really look? This is what the UI would approach and how we would break it out. So we can create work units and microtasks by category and groups. In this case, we're just using first names, but even numbers that have, say an identification number, a personal identification number, we can send that out, or we can cut it into smaller snippets so that there's no context to the meaning of what that number is. So what we do is our technology assures that only one person is seeing this. We then have, of course, the ability to validate that data if it doesn't match with what the AI has also taken an attempt to. and we can send it to another person to validate and guarantee the accuracy. So what we're doing is really presenting very clear and understandable and digestible tasks to crowd workers throughout the world. And in this case, even, you know, you would have like a grouping of numbers, but really at this point, any human looking at this would only see, you know, handwriting and numbers as a bundle. They can enter this text in, and we can make sure that the right numbers are picked. So there's no context to what these mean, and this is just a good example of the different kinds of variations that we can focus on to pull out and create meaning for our customers. So another, you know, approach and an important thing that we're doing, you know, AI, of course, being the topic du jour of the past, you know, many years, but this is, you know, how we're doing this is creating an abstraction of documents that are, you know, private information. In this case, we have a vaccination document. We're creating an abstract that then a task in the crowd can say, okay, we don't know who this patient is. We don't know what the meaning is, but we can create something that we send back, and we can categorize this document based on AI doing something very smart. In this case, what we're doing is AI is deciding what the intent is of the document, and which putting in, you know, the specific words, and the names and the summaries are redacted. The names are redacted so that then the crowd worker can decide, okay, this is what this document classification is, and this is the abstraction we can send back to give a summary of what is happening in this case. And there's no breach of any type of security or personal information out to the crowd, or out to the results, I mean. So in summary, you know, for prescription processing here, you know, we already, as ScaleHub and with collective intelligence, create scale. We're processing millions of documents and there's millions of fields every day in as little as an hour. It doesn't really matter to us the volume because we can scale so easily. We also guarantee the accuracy. This is something that's signed on an SLA document with our customers. And we have unlimited, you know, in a sense, resources. We don't really have a demand or a block on how many humans we can bring into a process. And we're creating a 100% automation approach, whereas if you're using, you know, an IDP platform, you're only going to have a certain level you achieve. With us, we are guaranteeing the achievement of 100%, and we're securing the data, we're protecting the data, and that's part of the guarantee as well. So for prescription processing, clearly it's a good match. It's what we're doing with customers already, and it's, you know, a novel way to approach how these documents and fields are processed.
Thank you.
So I'm going to pass it over to Susanna for some good examples of real life. I've mentioned some generals, but she's going to get more specific.
Yeah. So what I'm trying to do is bring a bit more to life now with some examples that we see from around the world, and to just show you how it can be applied, what changes we address, and how it really works. So the examples I want to draw upon today are medical prescriptions, so medication prescriptions, whatever you want to call that. The specialized area of compound prescriptions, which is quite important in some parts of the world. Then, you know, going away more from the public to the private side, because that poses own challenges. And last but not least, the whole area of therapy, care, and even care aids that has got other changes to come with it. So starting off with the medication prescriptions, I already talked to you or explained to you, for example, the changes that we have in Germany, and it's for us is one good example of where collective intelligence can help. So what we're seeing across the world, but especially here in Germany, is that with this kind of document, a lot of challenges are related to either high volumes. So we are in autumn now in many parts of the world. So autumn is a time where there's a high amount of flu. We see the COVID cases going up, so prescription numbers go up. And while some seasonal peaks are predictable, there's always unpredictable peaks as well, related to maybe some specific outbreaks or events that are occurring. Many countries experience tight service levels and very critical service levels. Like, for example, in Germany here, our partners we're working with, we are specialists operating processing centers, have really a few days in the month only where they have to process a very high unpredicted amount of prescriptions to then be able to fulfill their critical part in the process and actually get reimbursed for the money they do and not have to fund money as well. And there's varied rates of digitization. So, for example, let me talk a little bit about Germany. In Germany, we have a high amount of paper. I will say that a few times now, but we also have a varied rate of digitization. So the paper that's there, it's not as though that's a process that's not automated in any way. So the specialist providers which are dealing with those prescriptions in the public side of things, they have automation rates already of 90% plus, even 99%. But even those which 1% of exceptions going through, they have to deal with some challenges. So if they have to process this 1% in a few days in a month, this could mean that one day they may need 1 or 2 people validating data, and the next day maybe over 100 or more than that. So we're seeing easily peaks of 7,000% and more from one day to the next. And this is where collective intelligence can help, because as Peter was explaining earlier, here's more the human part of things. So what we do is we actually take over the information via very innovative means. Where are the gaps? What has not been processed in the past by the systems already in place by our customers and partners? We then prepare that by microtasking it. So we're ripping it apart. So there's absolutely no chance of a context ever reaching a worker that we bring in. And then we engage the help of our global crowd that actually can be activated on demand 24/7 to come in, take the challenge, process the task, and go out again. So really breathe with the requirements of the process. And as I said, one day we may help with 1 or 2 hours a day, and the next it could be several hundred people working really 24 hours to help processing that. And it's really works in the way I just explained it. Is really an automatic breathing up and down and helping with those tasks. And of course, with the ability of creating very high quality of data, it helps then again to bring the digitization rates and automation rates up again, because it can feed also the AI that is being utilized in the whole process. When it comes to compound medications or compound medication processing in wider sense, the prescription document will very often look completely different. So here we have not so much standardization as we have with the public side of prescriptions in many words, but you have variable layouts which can vary by region, by practitioner, and of course the content itself is very varied, especially in the area of the ingredients of the medication to be created. There very often are very complex tables, and these tables do not follow any rules. So one of the challenges is really to ensure how can this table data be recognized in a very high quality way, and not only recognized but also interpreted to match the way that thereafter the compound pharmacies are being able to provide the medications required here. So there are certain compound medication recipes, I call them, that are maybe have a match already in something that's very commonly used. Others have to really be individually recreated, and there's a lot of details in that. So what can collective intelligence do here? Of course, it cannot do the work of a pharmacist, but what it can do is can prepare very clean data on demand and very quickly. And what we're doing here in particular is focusing around these tables. Tables play a big role for us for many other use cases as well, like for example, invoices and the other commercial processes or enterprises. So we have special means of identifying tables, again creating microtasks with tables, and have also validations behind tables to support then the matching that may be required. And we can also support towards maybe databases or part lists, or in this case ingredients for compound medications, and also then provide that information in a clean and structured way so that the process can follow on based on this data and decisions can be made by the pharmacist thereafter. So here we are coming to the area where we may require some more knowledge when it comes to focus matching. So we have also in our crowd some what we call generalists and specialists, which can be pulled upon supporting the task that we are dealing with. When we're talking about variable layouts in compound medications, they get even more varied when it comes to private healthcare, because here very often there is absolutely no standardization, and there's the ability to utilize even the what we all know from maybe from films from history, the nice handwritten prescriptions are still existing here actually more often in the other of the areas. So it can be varied in layout. It can be handwriting, which is very challenging because it's not structured. It's not even restricted handwriting. It's cursive handwriting, and the content is often not standardized. So it can be more described rather than standardized. So here we're also looking at very low digitization rates from the in many countries, as well as an outlook that it will remain so. So what we do here, this is very much going into the area that Peter showed you last. So we draw upon a lot of different techniques that we can draw from AI. So we anonymize data in many different ways in order to ensure that some of our crowd can actually help with identifying where important parts are on a document. We are utilizing very specialized AI for handwriting recognition. Here we are specializing quite a bit in different industries, healthcare being one of them, where we are actually improving our own AI more and more with the help of course, of our crowd, which is validating the data. So we are utilizing a lot of AI here, and of course the crowd, to ensure that then the resulting data is not only structured and meaningful in the way of the further processing, but of the highest possible quality as well. The whole area of care, if you have at-home care, for example, therapy, maybe physiotherapy, and medical aids, you may require a wheelchair for a certain amount of time, or you need certain other aids, is putting even more challenges to what I already described to you. So here we often see unstructured documents even, whereby with healthcare, private healthcare and public healthcare, there is some structure at least recognizable. Here it is completely out of their hands, because there may be somebody who's an individual providing care or therapy, creating their own kind of documents, and of course handwritten documents are not uncommon in this area as well. What we're seeing also across the world in those countries with an aging population is a really increase in volume, which poses a lot of challenges for the process, and of course requires some support in order to make this process smoother, especially as there's hardly any digitization strategy available for many of these areas in the in this care, therapy, or medical aids aspect. So what we do is very similar again, and I would like to summarize it with the next slide. So what we always do in these cases, and of course the detail in the nuances vary, but what we first do, we identify the gaps which are presented to us in the process, and we prepare with AI the micro tasks that are then require further human in the loop handling. So our AI, of course, will look at what is the challenge we have been posed upon, what wasn't recognized by our partners, by our customers before. We will then try to identify and try to at least have the AI support human in the loop. We prepared a micro task, like for example the snippets. When you saw the snippets that Peter showed you, where someone may have to validate a name or a word or a number, and we are then distributing those tasks in a very controlled manner. So out then is coming in our human intelligence. We have a global crowd that's mainly capturing and validating this microtask data, so really simplified to their individual ability and possibility task that is being provided. And we have a specialized crowd also supporting that is handling, for example, decisions when the validation, the capture result, for example, from the global crowd doesn't make any sense. There are differences when, for example, two crowd workers disagree on, is this a 1, is this an L or whatever it would be, is this an 8, is this a 3 in a number, then a specialized crowd would handle such decisions, but also would be able to help with other decision preparation, which require more specialized knowledge. So this is really the general flow that we are following with all those examples, and help to fill the gaps on demand. As Peter was saying, it's a service that comes on demand, it comes with service levels guaranteed, and it's there as an extended workbench to really help to improve the process and provide also data that then in return can ensure that the digitization efforts are actually providing higher and higher automation levels from the beginning. So coming to the end, and before we go into the Q&A, I hope in the last half an hour or so, we have been able to show you a little bit into the world of collective intelligence supporting prescription processing. So it can actually eliminate automation gaps by coming in as and when required, by utilizing techniques that allow the involvement of external human-in-loop help without it compromising data privacy, with the aid of, for example, microtasking, anonymization techniques that AI can provide. It can help actually increase processing speed, because it is scalable. The human in the loop can come as easily as 1,000 people in 10 minutes. So imagine how much you can actually process in that time. And it also comes with a lot of improvements in data quality in the combination of AI and HI under control that can be created by that, and in becoming as a transactional on-demand extended workbench. It can also help reduce costs that are especially related to peaks and unforeseen circumstances. So while we are gathering your questions, I would already put you put our contact details on the screen for you. So please feel free to reach out after the session as well, and maybe share your experiences. We always love to hear experiences and other challenges as well, because there are maybe areas that we don't see today, and where collective intelligence may be something that can help, and we would love to go into discussions with you. But let's have a look, Peter. Do we have some questions? What can we see?
We do. Yes, we do. So let me put this first one out. So it was on, I think it was on that last slide or the two before, you had the specialized crowd up. Are these workers trained in medical or pharmaceutical terminology? How do we ensure the qualifications? And are they vetted before we provide them with tasks?
Yeah, so when we talk about a special crowd, there's different things we mean by that. So a specialist can be somebody who is maybe somebody who's specialized in a certain aspect of maybe being able to recognize certain handwriting or so on. But we do also have qualified personnel within the crowd. So how do we assure that? We have a patented technology that allows us to select and distribute the task according to the abilities and the certifications. And of course, if you have specialists in the loop, then the certifications that we have and the compliances that we can provide go end to end. So there's different means that we do that. Our goal is always to make the task in such a way that we can include as many people as possible and be a really inclusive provider of work, because we really believe in that. There's a whole area of social responsibility that we can talk about another hour about, but we have all levels of that. And yes, we do have also specialists, and we have a very tight control mechanism to ensure how and when we bring them in the loop.
Thanks. Yeah, I've got another one here about the turnaround time. I think the idea here, so it says that what is the guaranteed turnaround time for the data entry jobs? And I think I get this question a lot because, you know, having an SLA or signing a document that says you're going to guarantee that, how do we do that, number one, and what are they? So we have different levels. Our general is 8 hours. But in healthcare and in, you know, prescriptions like this, of course, we're seeing more and more people pushing us, or organizations pushing us, to do as close to real time as possible for the value chain downstream, for the patients, for the clinicians, to have everything available to them. So we can go as low as 1 hour, and we don't hold back artificially. So, you know, if you send it, even millions of them, as we talked about in the presentation, we have many cases where it's, you know, 40 minutes, 30 minutes or less, you're getting the data back, or as it's coming in. So, but the guarantee and what we sign as an SLA is, you know, based on the job and how we do it, but we can guarantee it because of the way we approach it with collective intelligence. That's how we can guarantee it, with the human involved. Okay, let's see. All right, so this is a good one, I think, for you, Susanna. Data security, we talked about that. You know, we talked about the global crowd, but is it possible to restrict this to the EU crowd only? We absolutely cannot allow to have any of our data go outside of the EU.
Yeah, so yeah, simple answer is yes. So we are able to restrict the crowd on region as well as on skill, as I said earlier. So just outside of healthcare, what we did last year, we supported one census in one country in the EU where we had to absolutely restrict to EU only. We hear that a lot. So what we always say is, of course, think about why you want to restrict it. Sometimes there is a good reason. And let us help you, of course, also with the discussions with data protection officers. But yes, if there's a need to restrict it, it can be very, very narrowly restricted down to a region or skill, or whatever level it is required to be.
Okay. Yeah, I think this one final one, I think, is a good one, because they're talking about the use cases that you showed, or the examples you showed. So, and this one would be for you as well. So the integration and implementation of those solutions are the ones that we have already started. Do you have any idea of how long, or expectation of timing from, you know, start to finish and into production it could go?
Okay, yeah, so the use case I just explained today, roughly, when we already have experiences, we have set up process in the background, it really takes as little as, it's really a few weeks and up and running. I mean, the majority of the time is really there to get the connection, because it needs, we have got different means, but especially in the healthcare area, we do take data protection, data security very seriously. So there is some work to be done to connect the organizations together, and but thereafter it is very fast. So it's actually a very non-intrusive kind of integration. So which is also a benefit, because very often, you know, if you're already up against the wall with having peaks and having exceptions to be handled, the last thing you need is really another big project. So it's really not that. It's a very non-intrusive process. There's very various ways of integration there, but they all are fairly simple to do. And thereafter, the process with testing, and then a run to ensure that end-to-end it all works. It's very fast, in a few weeks, if not even days in some cases.
Yeah, and I'll add just to that too, because of collective intelligence, you know, my experience within the document processing world and what we're doing with collective intelligence, it, you know, the training sets of the documents, we showed a little bit of that with the anonymization of the records. We can build training models much more quickly, which diminishes the amount of time to production, because you're not waiting months to build the training sets, you're waiting weeks in most cases to actually use the methodologies we have, because the human review and the building of the models is built into the solution, and makes it much easier in a sense for even our consulting services or our customers to see results quickly. So
yeah, I just did another extreme recently, a healthcare related kind of topic, but it was about like a survey, a very high amount of documents, and the challenge was it had to be done within like 4 weeks or so. So the challenge everybody saw was in the processing, because it was millions. The challenge I saw was more in, okay, we need a few days, need 5 days to set it up, because I know once actually it's set up and documents have been scanned. I think is a bigger challenge. The crowd wakes up. So there's thousands in 10 minutes. It doesn't stop. So the more the more feed our crowd in that sense, the faster it gets. So even the census was a good example. We had millions and millions in a very short period of time. Is what our crowd loved, and the way we do it loved. So that's never the challenge for us. The challenge is, we see the challenge is more, how fast can we get you up and running with us, and then don't worry about the processing itself.
Yeah. Well, that's all the questions I see, Susanna. Thank you for
thank you everybody very much for your attention and for your questions. As I said at the beginning, we will send out the recording to you. So, and please reach out to us. We would love to talk to you, and hopefully see you also at our next session, and have a great rest of the year, great rest of Q4, and a very relaxed and festive season.